Hi, I'm Erin Hartnett. I'm back to talk to you about how you can prevent caries in your pediatric oncology patients. One of the most studied factors to prevent caries has been fluoride. Fluoride in the water, fluoride supplements, fluoride in the toothpaste. But more recently, we've been using what's called fluoride varnish. And this is a clear varnish similar to nail polish that can be easily painted on the teeth to prevent caries. It is very inexpensive, it's easy to apply, it's well tolerated. And we've been using it in our pediatric oncology center where children on cancer treatment are getting fluoride varnish every 3 months in order to prevent dental caries. So you can do this in your oncology center too. The first thing to do is to find out what your staff knows, what's their attitude and what's their knowledge about dental caries, and then provide an education program for them. It's important if you have, for you to partner with a dentist or a dental school. We're lucky that we have a dental school here, but if you don't, find a dentist in the community who's willing to be supportive and that you can refer your patients to. Sometimes I've found a lot of dentists in the community don't want to treat children who are on cancer treatment. They're afraid of that. And so it's important to educate the dentists in your community as well as to what's safe for pediatric cancer patients. The first thing you want to do is make sure that you are explaining to the family what you're doing. Tell them that you're going to be looking at the children's teeth. Then what you do is you have the child in this position. It's the knee-to-knee position. And this way, the caregiver has their own child in their lap, and you have the child's head in your lap, and you can lift the lip and really get a good visualization of the teeth and the gums. And then here, in the same position, you can apply the fluoride varnish. But what is it you're looking for? You know, as oncology providers, we're very good at looking at the gums and the tongue and looking for mucositis, xerostomia, fungal infections, gingival bleeding, but we've always been ignoring the teeth. So what is it you want to look for in the teeth? Just look at these little white spots here. Along the gum, there's white lines, little white spots. These are the beginning of dental caries. These are demineralization. The acid is starting to work on the teeth. So just by applying fluoride varnish, you can remineralize these teeth. This is a more severe decay, these brown spots here. Here you would have to apply fluoride varnish and make sure this child goes to the dentist. This is further decay where it's actually gone into an infection in the gum and the child has an abscess. You have to be sure this child sees the dentist right away. You can still apply fluoride varnish. And this is a child whose teeth have actually rotted and broken off and just left stumps. I had a 3-year-old patient whose mouth looked like this, a little boy with a brainstem glioma. Can you imagine how much pain he was in? I had a patient who had 10 abscesses right before he was going to start treatment. So it's really important to get your patients to have an oral assessment before they start treatment. So anything that needs to be taken care of gets taken care of before treatment. And this is a picture of a child whose mouth has damage caused by holding the medicines in their mouth. So considering how many oral medications we give these children, this can be a serious problem in children with cancer as well. And the other thing to consider is when you have a child with cancer, is what their blood counts are if they need treatment. So to be sure that any dentist you're partnering with, you call them, you explain to them what the child's blood count is, you send the patient with the blood count, and to be aware that there are times when they can't have treatment if they're really neutropenic or have thrombocytopenia below 40,000, but there are times when you need to use clinical judgment and you need to partner with the dentist to know when treatment is needed and when it needs to be deferred. And then the most important thing to do is to be sure the family and the staff know what's important about oral care. that they're aware that it is important during treatment, that they know that the child is still supposed to be brushing their teeth twice a day for 2 minutes with a soft toothbrush, that they have good nutrition, that they get their fluoride every 3 months, that they rinse their mouth. If they are having frequent snacks, they rinse their mouth or they drink water, not sugar, not soda, not juice in their cups, and that the family and the dentist are aware of the hematologic considerations. So with all these simple, easy steps, you can easily prevent your pediatric oncology patients from having any dental caries. And I've provided the list of resources here that you can easily refer to.